we are live now. You can start.
Okay, hi everyone. My name is Morioki. This is the SAS-K, Skeptics and Atheists Society of Kenya. So today, the topic is letting go of somebody who's a loved one who's terminally ill, letting go of a business, and a failed relationship like marriage, yeah, or just any relationship. Yeah, so basically it's like letting go of those three things. So now, to start, the first thing I want to ask you guys, when you hear the words are terminally ill, what goes through your minds? That this person is terminally ill. What goes through your minds? Thanks. Okay, Stano.
To me, terminally ill is when somebody, the sickness, you see there is no any hope of recovery, or you are just counting days for that person to pass away or to die. So that is where we can say is terminally ill. So when the person, there is no any hope, or their chances of recovery is almost zero. That is where we can say is terminally ill.
Okay, thanks, Stano. Anybody else? When you hear the words are terminally ill, what goes through your minds? Thanks. Okay, Doctors.
I would say the exact same thing that ex-Pastor Sano has said with different words. Yeah, a terminally ill person is somebody for whom science or medical technology cannot assist. They've reached the end of the rope. Probably they might be suffering from an illness that has no cure, such as cancer or AIDS. Although that one is squeezy, it's disputable. It's not curable per se, but it is manageable. Or they could be suffering from an ailment that is so far gone, like so far advanced that there's nothing modern medicine can do for them, that they just have to finish the course and end their lives. They are on their way out of this planet. That's a terminally ill person. There I'm thinking of people who are advanced in age, or just somebody who has a disease which is extremely advanced. It could be pneumonia, it could be COVID, but they've just gotten to a point where they can't be helped. It just can't be reversed. Yeah, that's my understanding. Thank you.
Okay, thanks, Dr. Am I clear now? Stano, am I clear? Stano, am I clear?
Morioki, you
Yes,
need to talk
clear,
some more. You need to
Yeah?
talk some more, but you
No,
need
okay.
to talk some more. Have you changed your
Okay,
location?
fine. Yeah, I've changed. Okay, okay, Luchavileli? Luchavileli, you
Yeah.
can go.
Hello, Muriuki. Hello, can you hear me?
Yeah, I can hear you. Yeah.
Okay. I think I'd very much agree with all what people have said, who have spoken before me. I think I'd also agree on the same, that basically it's whereby we have a condition where it's either incurable or it's irreversible. And one usually has a limited time they have. So typically we say 6 months or less. So anytime you've been told that you're having 6 months or less and you have an incurable condition, or it's irreversible, whether damage has been done, whether it's end organ damage from all the organs, whether it's liver disease, kidney disease, heart disease, and it's reached to a point where you can't really cure it and you can't really reverse where damage has already been done and you have limited time. It's usually 6 months or less. That's what we call terminally ill. Now, when it comes to age, where our previous speakers say that age can be one of it. I'd say that age itself, it's not really a terminal condition. However, the complications that come with extreme aging, we call it being senile. Yeah, things like we have neurodegenerative conditions where your nerves start to bring to have issues that affect your functioning, and they all in all at the end of the day it will determine someone's health, someone's outcome. They end up dying because of that. It's not the age that has killed them, but the complications of age. So those complications are, yeah, they can lead to terminal illness. But age in itself, nah, it's not really. I wouldn't say it's a terminal illness. But yes, I'd say that as long as you have an incurable condition and it's irreversible. Now, when it comes to HIV, yes, right now, HIV is treatable, though not curable yet. Probably it's curable in the West in some narrow specific occasions where people have been done, a full bone marrow transplant. Those ones have been cured of it. But for the majority of the population, we say it's just treatable, not curable. Yes, and we have the stages, though. So we have 4 stages. So 1, 2, 3, and 4. So when you are at stage 3, it can still something can be done. But when you come to stage 4, yes, it can lead to terminal complications. Yeah. So yeah, I think Dorcas, you're still right when you say that HIV can be one of them, but only when it's terminal, when the damage has been irreversible, where it has eaten your organs, whether it's the liver, the kidneys, even the brain itself. Yeah. So yeah, anything that can lead to that, we call it as terminal illness. So that's what I'd say. Yeah. Thank you.
Okay, thanks, Chabaleli. Anybody else? When you hear terminally ill, what goes through your mind? Anybody else? Okay, maybe I'll give you what I have here. For me, I have it's a medical term that refers to a person who has a disease that can be cured and that will eventually lead to their death. Yeah, it's a medical term that refers to a person who has a disease that cannot be cured and that will eventually lead to their death. I think that's what most of you guys say. Yeah. So now, okay, examples of people who are terminally ill. Can you give examples of conditions that can be considered to be this person is a terminal? Anyone? Examples of a terminally ill situations or conditions? Anyone? Like
Can I try? Can I?
cancer, in one of them, cancer. Yeah, you can raise your hand. Just raise your hand. Raise your hand. Okay, Julius, go. Julius.
Yeah, so I can say for me an
Julius can
example of
go.
that. Yeah, can you hear me? So
Yes,
I'm saying
yes,
for
Morioki.
It's
Morioki, you're
raining where I
also
am.
breaking off.
Julius.
Morioki, you're breaking off. You need to
It's
find
raining
a
where I'm in a
better.
rainy place. Sorry. Yeah. It's okay.
okay, so for me I can say a terminally ill person, for example, is a person who has stage 4 cancer, and now it has actually metastasized to more than one system. Like it is in the brain, it's in the liver, it's in the kidney. Yeah, so that's a very terminally ill person, and we can just have take care of them before they die. Yeah.
Okay, thanks, Julia, sir. Okay. Anybody else? Examples of people who are terminally ill. Maybe Eugene, Eugene. Maybe you can give examples of people who are terminally ill.
Yeah. Thank you, Maruki. Okay. From the definition where I say that if a disease is incurable and irreversible damage has been done. So any condition, like yes, someone has talked about stage 4 cancer, or we can call it advanced, advanced cancer. Yeah, that's one of the causes of terminal illness. Another one, it's we have these neurodegenerative disorders, like for instance, things like ALS. It's where we have the nerves start to fail and the people really end up, it's like a progressive illness where where you have muscle paralysis, but it's gradual, and you need your muscles even to do things like breathing. So it starts with the non-important muscles, but when it gets so severe, it comes with a paralysis of the muscles that you use to breathe. So these people usually suffocate as a complication, so they qualify as it's one of the terminal illness. Like, yeah, we have it also. Like, you can talk about things like cardiac heart disease, where whether it's end stage, like it's not early, because when it's early it's treatable, but when it's too advanced, the cardiac patients, like, yeah, all you can do is just provide comfort for them, because yeah, that's all you can do anyway, because you can't really treat them or cure them or reverse the damage. So those are some of the complications. I mean, those are some of the conditions. Even things like when it comes to chronic kidney disease, where it's where both your kidneys have really failed and you just have to go for dialysis. This is a machine that takes over the function of kidney. The kidney, usually we can say it cleans your blood to make you healthy. So when your kidneys fail, your blood becomes dirty. It gets filled up with toxins like urea, you name them, all the byproducts. So these people usually don't have functional kidneys, so they have to go to a dialysis machine. But some of them, it's too advanced, and some can't really afford a dialysis machine, so they end up, it's part of those terminal illnesses, so they end up dying one way or another. Yeah, so yeah, those are some of the examples. And even we can have some congenital disorders. This congenital happen due to, they happen in the womb as the child is forming. So you can have some mutations where someone somewhere is born with a condition that probably even at a young age, when we talk of terminal illness, probably most of us usually think, it's just old people dying, in their hospices or at home or at the deathbed. But even kids can have terminal illnesses, especially when they have, this bone marrow issues, whether it's bone marrow cancers, and also some tumors. They can also be said to be terminal illness. They just, it's whether it's just irreversible and it's untreatable, and you have less than when and you have just a limited time. It can be in the Kenyan context, we say it's 6 months. Yeah, 6 months or less. So when your doctor tells you that, what, you are having 6 months or less, just do what you can in your life. Say hi to your friends and your family, stick with your family close and all that. That's just terminal illness. That's just an example of it. Yeah.
Okay, thanks, Eugene. So, anybody else of examples of I think you call when somebody is terminally ill? Do you have any other examples? Anybody? For me, I'd say like when you're brain dead, I'm in a coma. Yeah, for me, if you have if somebody says you're brain dead or in a coma, you're terminally ill. It's hard for you to come back. Yeah. So, any examples of terminally ill situations? Okay. Okay, fine. Maybe I can move on then. So, the question is, when is it right, and who decides? Is it the doctors or the family of letting go, of saying this person has reached their end? Who decides? The doctors or the family? Thanks. Yeah, anyone who decides let somebody go? Is it the doctors or the family? It's on whose hand? Okay, that's a doctors. Doctors
I
can go.
think I'm not.
Doctors.
Yes, I'm talking.
Okay.
It's like there's a delay on your end. I think I'm not very qualified to speak about this, so I am very open to correction from the medics. I see Kelvin Kambi Chili B is a medic, and also we have Eugene Lucheveleli, who is also a medic. Maybe they will correct me because I'm not very familiar with medical ethics. But I think the person who should let go of a terminally ill patient, I don't know. I don't know how we phrase that question, because I would think when you are letting go, it means that it's towards an object that is outside of you. So automatically it means that it is either maybe the family members, friends, or the medical doctor who is doing the letting go. But you see, that would mean understanding the issue from an emotional perspective or a psychological perspective. But the way you have phrased it, it's as though you're asking about that terminating point. Who is the one to decide who terminates the medical intervention? I would think it should be the patient first and foremost who gives those instructions, and then the doctors will implement the instructions. So there are some patients who decide that they don't want to be poked and prodded continually when there's no hope for recovery. So they leave instructions that when it gets to that point and they're not conscious, they're not able to tell people, do not resuscitate me or do not put me on a life support machine because maybe they've lost consciousness or they can't communicate. They leave those instructions. They tell their family members and they tell the doctor, the concerned institution, hospital, that when it gets to that point where modern medicine can do nothing for me, then stop it. Don't continue putting me on the life support machine. Don't continue piling bills for my family to suffer from. Instead, just end it there. There are also other patients who say that they don't want to be the object of experimental interventions because there might be some breakthrough technology that is still in the pipeline. It hasn't been patented or fully researched. So there might be some patients who want to receive that experimental drug or intervention, but the others who say, no, I don't want any more medical procedures when it gets to a certain level. So I think the onus is with the patient to make that final decision, according to how you have asked the question. Yeah, I don't want to ask my own question or give my own interpretation of what I think when I hear the word letting go, because for me, it seems as though it is a psychological step that is on the people who are left behind when the terminally ill patient passes on. So I won't get into that. I'll just answer the question as you have asked it, Mr. Moderator. Thank you.
So, doctors, if the person is brain dead or in a coma, can you say that's obviously the doctors will decide if the patient can't talk, they are brain dead, in a coma. Can you say no, it's obviously the doctors will decide. Is that accurate? If the patient can't speak for themselves, they are in a state that's
No,
vegetative,
no.
they can't talk, they can't communicate.
Not necessarily, and I stand to be corrected by the medics here as I've considered. There are two medics in our midst. And in fact, Kelvin, your hand was up. I don't know why it has gone down again. Please don't be shy. We need to hear your voice. Yeah. So I was replying to Morioki. You're asking that when the patient is in a coma, that decision should be put on the medics. I disagree because there are some patients who would wish to remain in a coma. We've heard of people who've been in comas for months or even years. And the doctors have not disconnected the machine because it was the wish of the patient or the patient's family that the person continues to be kept alive by the life support machine. So it's not necessarily the doctor's decision. I think it's the patient's or the family members, but I stand to be corrected by the guys, the medics who are here. Thank you.
Okay, thanks, doctor. So, Kelvin, yeah, who decides? The family of the doctor? Kelvin.
Okay. So based on how I learned this back in uni, there's a unit we call it ethical issues and medical jurisprudence. So there's usually like a framework, and I think Dorcas ameelezea it in a very good way. So the primary decision maker is usually the patient, though there are some conditions. The patient has to be mentally competent, if that's a word, and that's when they can decide whether to continue or stop treatment based on their values, their goals, or the understanding of the prognosis. So let's say you have a patient who has an advanced metastatic cancer and they choose to stop chemo because they feel that the side effects will outweigh the benefits, and they prefer just comfort care, palliative care, hospice care, and such stuff. So as a doctor, as a medic, the decision of the patient stands. Now, if the patient is not in a position to make such a decision, it now falls into the family members, the immediate family members, or any legal surrogates. So you can have a patient who maybe has dementia, a patient maybe who is unconscious, a patient in the ICU, a patient who is sedated. So in such a case, it's the immediate family members of the legal surrogates who get to decide. Then the other third scenario would be now in the absence of now a family member or a legal surrogate, it would now fall on the shoulders of the healthcare team. So of course, a discussion on the prognosis, the treatment options, and the various recommendations would have to be done. And now that decision of now letting go, it would now be done by the medical team. Again, still there is some extent of involvement of the ethics committee. So, okay, in my practice, I haven't yet found myself in such a scenario, but there are usually ethical committees within the hierarchies of a hospital. So, obviously, in cases of conflict, they may be involved, and then there's also now the actual even involvement of the legal systems. But I haven't really encountered such cases in my practice, so I may not have the adequate knowledge regarding that. But regarding now that specific framework, it's in that order yenye nimekupatia. That's what I learned in school. That's what we implement.
Thanks, Kelvin. Eugene, who decides? Family or doctor? Eugene.
Yeah, I think Kevin did a wonderful job in explaining it to detail how it usually goes. Yeah, you know, it all revolves still revolves around the issue of consent. Consent usually guides everything, like almost every aspect within the medical practice and the spheres of medical ethics. So it's all about consent. So who actually determines? And also even like before we talk about who determines, I think we should have a common, probably maybe a common perspective, or what do we really mean by letting go? Because I've just come to realize that letting go doesn't have one, doesn't have one meaning written in stone. Letting go to someone might mean something else. To someone, it might mean, pulling the plug. To someone else, it might mean, just abandoning, just stop to visit that person who is terminally ill. Just, you just let go of them. So I think we should have first started by, probably explaining what we mean by letting go. So in this aspect, I think I would assume, probably when I talk about letting go, I think Muriuki, you mean pulling the plug, yeah? Just to have a common perspective. So
Yeah,
yeah, that's what
yeah.
you
I mean,
meant.
like
Okay.
seeing they can go and how to deal
Yeah.
with the aftermath.
Okay.
Yeah, yeah.
Okay. So technically you'll be doing what is known as euthanasia or mercy killing. So it's I will say yes, it's actually wonderful that you're still talking about it. But I will just like to point out, like, it's multifaceted. It's not as simple as maybe someone somewhere might think. But yes, it's actually wonderful you're talking about it. It's called euthanasia. And how what the Kenyan laws says about it, it's actually illegal. It's not really a legal thing. When the authorities are notified that probably a certain euthanasia has been carried out, it will warrant an investigation, and some people will be implicated. Let's just by the way. But yes, in the essence of discussion, because yes, we cannot bind our minds just because it's illegal. Now we can't talk about it. I think we are free thinkers. So yes, it's wonderful that you are talking about it. So that was just a disclaimer that yes, for those who didn't know, euthanasia is illegal in Kenya. It doesn't have, it's an absolute illegality. But yes, it does happen. I won't tell you that just because it's illegal, it doesn't happen. It does happen. Clandestine euthanasia happens behind closed doors, where people aren't really looking. It's an in-house thing, probably between the management and those affected families and all that. But it happens. Just like the same way we have abortions going on, like, just because it's illegal, it doesn't mean that they don't exist. They're there, they happen. So that's another aspect that I'm bringing up. And then, okay, now, so assuming we were in the West, or let's assume we didn't have restrictions about it, who actually decides? Just as I've said, it's all the issue of consent. And just as Kevin had earlier said, had earlier clearly outlined about it, I don't even want to belabor his points because he explained it perfectly. From the patient himself and all that. Still, and then when you don't have anyone, then the next person who can give that consent, it's usually the healthcare team, probably the most senior healthcare team there. And but yeah, it does happen. And also we have things known as advanced directives. One of them is the living will. So when someone is terminally ill and they know they're terminally ill, even before they end up complicating in the hospitals or in the hospice and all that, or they probably warrant, probably they talk about euthanasia and all that. Um, a living will, it's a document that they write while they are of competent mind. It's like the same way that you can write a will and say that, your property should go to this kid and that kid, and the same thing you can actually have a living will about the same. So those do work. It's part of the advanced directive. Another thing apart from that, just as Kevin had said, yes, it's usually it's the ethics committee of the hospital. If there's really no one around that person who can give such a decision, and to what grounds can it warrant to pull such a decision, realistically speaking? Yeah, you know, um, most of the time they usually weigh the cost, the benefits versus what's really what's really being given off, what really the family is losing. And compassion is usually one of the key ingredients of what is usually looked on. For instance, if, for example, the cost of treatment, that's in the West anyway. If the cost of treatment is expensive, it's very expensive. And the fact that someone is there in the hospital, they are on life support machine, the bill keeps going up, it doesn't really help. If anything, that's brutal. So it usually happens. But in Kenya, just I've told you, it's usually legal. It has never been documented legally that it happens. And if it happens, it will be an offense because it will be legal. And even before you finish on that, I think Muruki, you earlier talked about, you say that coma, to you, coma is a terminal illness. But yes, one might think that, but I'd like to correct you on that perhaps. Coma, most of the time it's usually due to something. It's not a diagnosis in itself. Like it's not a standalone illness or condition. It's a manifestation of a certain underlying condition. Even your blood sugar can be very low and you end up in a coma. And you can't say that you're terminally ill, because if we give you glucose, you'll just wake up like nothing happened. So coma, but it could be a sign if, for instance, we cannot identify the cause of that coma, and they end up being, just as you said, being brain dead and all that. And there's no sign that they can come out of it. But yes, people have actually come out of, such long comas, even 5-10 years. People have actually come out of it. So I wouldn't really say that it's a terminal illness. I would approach it, I would take everything with a grain of salt, not say that, it's a terminal illness. Just, we only say it's a terminal illness if it's incurable and it has progressed to a level that we cannot do the reverse of the damage that it has done. For instance, if it's a smoker who has been smoking for over 20, 30 years, they end up with a condition known as COPD, an obstructive pulmonary disease, chronic obstructive pulmonary disease. So their lungs become very obstructed, and that damage is irreversible. So most of them end up with no functioning lungs, and that's what kills them. So that's a terminal illness, for instance. Yeah. So, it's things that when damage has been done, it cannot be reversed. That's what we refer to as a terminal illness. So that's all I can say. Yeah. Thank you very much.
Okay, thanks, Eugene. Okay, one question. And Eugene, when someone is brain dead, can they come back from when they're declared brain dead? Can they come back?
Not really. When we say you're brain dead, technically, what we term as death, we usually have two kinds of death to say that. For us to declare you as dead, like time of death, this time, there's a criteria you have to meet. And in those two kinds of death, number one, we call it the biological death. The second one is the physiological death. So let's start with the physiological death. The physiological death, also known as clinical death, is only when your heart stops beating and your lungs stop doing what they do. We call it a cardiopulmonary cessation. That's clinical. In the old days, when people used to confirm if you're dead, they will check if your heart is beating and if you're breathing. If you don't meet that criteria, chances are you'll be buried that way. So there's a condition known as a Lazarus effect, where people have been waking up in morgues. People have been waking up, in coffins. And then some might say it's a resurrection, but no, it's not really. It's just a misdiagnosed premature declaration that someone has died when they haven't done a full medical examination to the body of the person. So the heart might stop beating. It's something known as asystole. It happens. Your heart just stops. It flatlines. and your lungs just stop breathing like that. So if you're working with someone who is not careful, and probably it's those old days, they check, they say, this person is dead. They put you in a casket. Now, when they want to put you on the ground, you start to knock the casket. People run away, and it's because someone somewhere said you're dead, but you're not dead. So anyway, that's clinical death. It's reversible. I think most of us have heard what is known as the CPR, cardiopulmonary resuscitation. So the essence of that is to reverse the clinical death to bring back, to bring you back. It's not that you're dead, but you're going there, you're heading there. So when this clinical death is not reversed, it goes on. It can lead to something known as biological death. Now, biological death, it's what is known as brain death. Brain death. So the brain has this functional area, we call it the brainstem, where it controls your breathing, your blood pressure, your heart rate, everything about you. It's controlled there. So when that part of the brain dies, it cannot be reversed. It can never be reversed. So when we say you're brain dead, they need life support machine. And what the life support machine now does, it's that it takes over that function of the brain. It controls your breathing. For you, it controls your heart rate and everything. So it does that. So you're on life support, but man, you're dead, like you're brain dead. That one is reverse. It's not reversible, it's permanent. So for us to say that someone A, B has died, time of death is this time, it's when they've met the clinical death and the biological death. So that's what we say is they're dead. Okay. So I think I've answered the question.
Yeah.
And also,
Yeah.
and also, sorry about taking time. I've seen someone had asked in the chat that he talked about congenital sickness can be teratogenesis, also be terminal. Okay, so what the question is asking, there are things known as teratogenic conditions or diseases. They are malformations in the fetus or their born baby that happens due to drugs, maybe alcohol the mom has been taking. So yes, they can actually lead to some terminal illnesses as well. So yes, that's all. It's only that. Yeah. Thank you.
Okay, thanks, Eugene. Okay, now we've defined a terminally ill. I think those two words have been well defined. Now, when you hear letting go, this person is a terminally ill. Now it's letting go. When you hear those two words, what goes through your minds? Thanks. Yeah, anyone, when you hear now letting go, what do you think? What do you hear when you hear letting go? Thanks. For me, letting go means a thing of acceptance. You accept what's going to happen. Then you make preparations of how to move on. Yeah, so the key thing is like acceptance. You accept this is going to happen. Then you prepare of how you move on. That's my 2 cents. Okay, Dorcas, let him go. Hope I'm clear. I'm in a rainy place. Dorcas, am I clear?
Yes.
I'm in a rainy place. Yeah.
Yes, we are hearing you now. Okay. So we had not defined the term. No wonder there was a little confusion when we were answering that first question. Maybe we should have started with that phrase before we got to who decides when to terminate. I think we put the cart before the horse. Nonetheless, when I hear the phrase letting go, I think of the psychological aspect as well as the physical aspect. Psychologically speaking, I think there are some family members that are not okay with the idea of our mortality. They will do anything possible to keep their loved one around, even when it involves beating up a dead horse, metaphorically speaking. So you see that medicine is not doing anything for them, but you just want to keep them around because psychologically you're not ready to accept their mortality. You're not comfortable with death. So you'll continue to do everything medically possible to have them around. That's the psychological aspect. And the physical aspect would involve you are using those medical interventions to sustain their lives, especially the life support machine. Now, a case in point, what comes to mind is the example of a certain colleague of mine. We used to be in a co-sharing space, and I remember he told me about his feelings towards his death and cancer, because as we gave the examples, cancer is one such terminal illness. So he said that if he ever got cancer, he wouldn't tell his family, because the way he knows his family, the family will do that is not just cancer, but if he discovered he has late stage cancer, because that's the one that can't be fixed. I believe when cancer is at the early stages, you can definitely treat it, or at least try to manage it. So he said that if he discovers he has late stage cancer, he wouldn't tell his family, because the way he knows his family, they will do everything possible to keep him alive, even when that is futile. They're just postponing the inevitable and making themselves bankrupt in the process. He doesn't want to leave his loved ones with the debt, and yet he'll still leave them anyway, even after all those interventions. So that was his position, that he will keep it private. But I wonder how feasible that is to hide such an important aspect of your life from your family members. But that story encapsulates the idea of letting go or not letting go. Like, he assumes that his family would struggle to let go of him when he's terminally ill, and they would keep doing everything, poking and prodding and taking him through countless rounds of chemo, even when the chemo maybe would not assist, it's not helping, or the harms coming from the chemo would be more than the benefits. So yeah, such a family, I think, is struggling with letting go. Yeah, that's my perspective. I think there's another element, but let me just leave it there for now. Thank you.
Okay, thanks, Dorcas. Okay, Eugene, when you hear letting go, well, what do you hear?
Yeah, I think yeah, that's why when I was beginning to give my first half of the take during my first time my first try, that is, I had given the context. I will say that to me, I don't think that it has one definition. It can mean different things to different people in different contexts. So it's equally important before gives a contribution of what they mean by letting go, because yes, it's just it's very much logical for someone somewhere to think that letting go means to pull the plug, and someone somewhere thinks that letting go thinks that you distance yourself from such things because you may like you just leave them, like. So it has different meanings to different people. To me, how I take it in this context of letting go, I still approach it with an open-minded take. Like, someone would say it's not really, it's not really talking about euthanasia and all that and all that. And now when it comes to the terminally ill and letting go of them, my personal take towards it, not just as a medic, but even as an atheist, I will say that I will just approach it with how we approach it in Kenya. In as much as, yes, when it comes to euthanasia, it's illegal. It's illegal by law. But what the healthcare system does to those with terminal illness, it doesn't tell them that, it's the end of the road. But to some
Eugene, are you there? Eugene? Eugene, are you there? Dorcas, can you hear me? Doctors, can you hear me?
Yeah, there's something wrong with Eugene's mic. We can't hear you. You're on mute.
Yeah, Eugene, we can't hear you. Or maybe okay, maybe he'll come back. Okay, so anybody else when you hear letting go, what do you hear? Letting go of somebody terminally ill, either a family member, a friend. Those two words mean what to you? Anybody else? For me, I said it's acceptance and preparation of moving on. Yeah, so acceptance and preparation. Anybody else letting go? Maybe Kelvin, what do you hear when you hear letting go? Kelvin.
I have a simple, I don't want to call it objective. I stand to be corrected. I think letting it go, if we strip it down to its core, in medicine, it literally means accepting the limitations of modern medicine. So let's say we have a patient with a traumatic brain injury and they are brain dead. So letting go in that sense would mean pulling off the plug. Then let's say, for example, actually this is now an experience. Sometimes last year I had a patient, a 10-year-old boy who had a bone cancer and osteogenic sarcoma on the left femur. So we did an amputation. It was actually in the left tibia, and we did a below knee amputation. And they were supposed to go and continue with chemo, but because of financial issues, they couldn't. And when I later came to saw the boy, metastasis had occurred up to the lungs, and I saw the despair in the mom's eyes. And at that point, they said, one, they couldn't afford any, they couldn't afford more, they couldn't afford to pay for any any further medical interventions for their son. So in that sense, they had decided to, quote unquote, let go. So that's another perspective of looking at it. And I'd say that's a little bit subjective compared to the first definition that I had given. Then again, let's say even if they had the financial muscle to opt for further medical care or something of the sort, and they decide to quote unquote let go. So in this case, they decide, for example, to ditch those medical treatment options that are available and maybe go for hospice and palliative care. In that sense, they're not saying like, let's do euthanasia in the literal sense, like let's kill the boy. But they're saying we have accepted that any more treatment is probably going to do more harm than good, and would rather improve the last days of this boy's life. Actually, essentially, palliative care, at its core definition, it literally means improving the end of life quality. So there are different approaches or different frameworks that you can use to coin up the definition of letting go. But I stand with my first initial definition, which is accepting the limitations of modern medicine and acting promptly.
Okay, thanks, Kelvin. Juliana, when you hear letting go, what goes to your mind? Juliana.
Thank you very much, Marioki. I don't know that I can add anything else to what everyone has spoken about. Now, Kelvin says it's letting go because modern medicine cannot do anything. I'd like to, if I don't mind, I'd like to add on to that. I think letting go because A, modern medicine cannot do anything, and two, even prayers can't do anything. I know this is an atheist group, but even as you're praying, can you at least let go? Or maybe that's where the faith comes in and you just pray until you collapse yourself. But to me, I'll add letting go because medicine cannot do anything about it and your God cannot do anything about it. Just an addition. Thanks.
El Maestro, in 2 minutes. El Maestro, when you hear letting go, what do you hear? Just 2 minutes, brief. El Maestro. Okay, Stano, When you hear letting go, what do you hear? Be brief.
I think people
Hello.
have already answered it. I think we should move on to the next question.
No, yeah, I don't hear. No, just don't hear a different view from somebody else.
Okay, maybe Semakula is raising his hand.
His hand is up. Okay, Semakula, when you hear letting go.
Okay, I can't find the normal. I can't find the normal hand raised thing, so forgive me for that. But I think letting go is essentially recognizing when to stop doing actions which have no effect and simply let things move on as they should. A lot of times what we do, human beings have this strange habit of pretending that there is hope even when there is none. We have a bad habit of never giving up. So I guess letting go, in my opinion, would be recognizing the limits where you have reached, recognizing that there is nothing more you can do, and being willing to accept that part and move with the consequences of you not being able to do anything.
Okay, thanks, Makula. So now this person has been told, this family member, you've been told by doctors that there is no cure for the disease and the person is dying. Yeah, so now what steps will you take to let go? Yeah, that's the next question. What steps do we take to let go? This person is not coming back anymore. It's been decided by either the family or the doctors that they are going. So what steps do you take to help in letting go? Thanks. How do you let go?
Was that to me as well?
Yeah, okay, you can answer. It's for the panelists, but you can answer. You can begin since you're on the screen. You can answer, but it's for everyone.
I think it really depends on the situation. If you're looking at a medical situation and you know this person is going to die, I would think I would try and make the last period that is left as good as possible for that person. If you're looking at a relationship, it's simpler. That one you simply walk out. A relationship or a business, it's a lot simpler. Simply walk out, close down your obligations, whichever they may be, and walk out. The death part is a bit harder because unless it's an immediate thing, it's going to happen tomorrow. But usually understand what the person really wants, try and make the best of what is left. Some people don't want to live longer. Some people are willing to live until it takes its time. But at the end of the day, I think the person who is doing the dying should be the critical part, not the rest of us who are watching him die.
Okay, thanks. Yeah, Dorcas, steps to take to let go. Dorcas.
I have accidentally pinned Lucheveleni and I don't know how to unpin. I don't know what always happens. Oh, ole. Anyway, what are the steps to take in letting go or when letting go? Okay, before I answer that, I have a question for the members. And in fact, this was triggered by the contribution made by Juliana, because she brought out the element of religion and false hope that many religious people tend to defy doctors' instructions because they believe that somehow there will be a miracle, there will be a supernatural intervention, and their loved one will live on beyond what modern medicine says. So, if I may ask you guys, because the religious tend to hold on longer than they should, and maybe this can lead them to extend suffering for the terminally ill patient. They use that false hope as one justification. Another justification is the sanctity of life. I know that there are people who believe that you shouldn't end life during, or let me not say during, but after conception. So they oppose abortion because they believe that it is truncating life, it is interfering with life. Likewise, they also oppose that concept of letting go or terminating medical interventions because they think that life should go on for as long as possible because they believe that life is sacred. But I think that is, again, not very objective. In fact, it leads to what? It leads to immense suffering for the terminally ill patient. In fact, it is the believers that are at the top of those who oppose euthanasia. But it's not just euthanasia, by the way. We must note that euthanasia is not the only aspect involved in letting go. It can just be further medical interventions. Yeah. Now, all of that was to lead to my question to you guys. Yes, we've acknowledged that religious people tend to overdo it when it comes to letting go. Is it true that we, as the irreligious people, might have the opposite problem where we let go too soon? What if there is hope that something can be done to elongate this person's life? Say somebody has cancer, right? I remember we had this discussion on the group and it was brought up by Kachoff. He said that if he ever gets diagnosed by cancer, he'll never spend anything on treatment. He'll just wait for the disease to take its course and kill him. No, he didn't say that. He said he'd travel to a country where euthanasia is legal and then he would take his life. But then I held a slightly different view. I told members, what if you could do something that would give you maybe 5 more years? And those 5 years are not so bad, right? It's not a bedridden life, but at least you've done an intervention. So I feel like sometimes we who are not religious can be too quick to let go. Just because you've been given that diagnosis that you have a chronic, untreatable illness like cancer, you assume it's pointless to do anything. So let me just let go, or let me not intervene at all, and then you die prematurely. So what is your take on that? Do you think us as the irreligious people, we let go too soon, and we allow our terminally ill patients to die prematurely? That's a question I have to you members. But on what the moderator asked, I think one way I would prepare, or one step I would take to let go as a family member of a terminally ill patient would be to organize for palliative care to reduce the pain they feel as much as possible, to make their final moments as peaceful as possible. If they're in a position to enjoy themselves, I would accord them some little luxuries. Let's say they have an idol that they really long to see, and you guys have the money to do it. I would take them to the place. You remember how Michael Jackson used to invite cancer patients to the podium and sing for them, because those are their last moments. So he's trying to make it memorable. That was, that's an example of something I would do. It might not be going to a concert, it might be visiting some location somewhere, or having them sample something or undergo an experience, maybe get on a boat, or just do something very different if their body allows. Of course, we are assuming here that perhaps they're still able to move. Maybe they'd be on a wheelchair, but they're still able to move and they're still able to perceive the environment. So you give them that last memory, that very rich and unique moment. That would be another one. I would also think of the practical components of letting go. I would consider the legal implications as well as the financial implications of their death. So I would ask them if they are especially advanced in age or they have assets, to write a will and to explain to everybody why they are dividing their property that way, so that we don't have disputes when they die. Or if they have a business, I would try to get them to share their knowledge with us who are still alive on how we can sustain the business, or if it's properties, if it's real estate, etc. How can we ensure that we keep this terminally ill patient's legacy? Thank you. And please answer my question.
So, Dorcas, maybe to answer your question, I'll say what I've noticed, whether you're an atheist or a Christian or whatever, I think it will depend on on a person, whether religious, atheist. That depends on I think what is brain structure, or how fast you have to let go. So it depends on someone, on somebody. Yeah. Okay. And Maestro, before El Maestro talks, Eugene, before you disappeared, can you complete what you were saying, Eugene? Because you went off before El Maestro speaks.
Yeah,
No,
that's the thing. I
Eugene.
think hello, am I audible? Okay.
Yeah, and I can hear you. I can hear you now. Yeah, I can hear you.
Okay.
Yeah.
Okay. I think we're having the same problem. It's actually raining heavily in my place. We actually had the power outage, but it's back right now. So yeah. But now I was lost in my train of thought. Where was I? Where had I read before I got disconnected? Saying lots of
Oh
things.
dear. Wow.
Oh,
Wow.
okay. Was I talking about palliative medicine? Yeah, I had mentioned that bit. Or not yet.
Paul, imagine.
Okay,
Yeah.
okay,
Okay.
okay. Let's just leave that, and I can just try to answer maybe Dorcas's question, or maybe give my take on that. Okay, so I think I missed what Juliana was talking about, but I will understand because you talked about it, Muriuki, or was it Dorcas, who said that yes, sometimes religion takes advantage of the state and sorts of prolongs or gives unnecessary suffering when there might be a simple solution. We know what probably that means. And now, I will very much agree with Dorcas that yes, when it comes to letting go, it shouldn't just mean euthanasia, or it doesn't mean just euthanasia. I will also opt for palliative care. Now, but when it comes to palliative care, it's a holistic package. It's a holistic care because you will be dealing with people from different backgrounds. You will be dealing with atheists who don't have any religion or don't have any weird coping, or probably they have any weird coping mechanism, probably, but they're not, they don't have the religious sort of coping mechanisms. And most of your clients, or most of the clients in a hospice, they are usually religious. And when it comes to palliative care, it's a holistic sort of care. So even spiritual stuff, it's part of it if they want. It's not for the secular hospices that I've seen that they don't force religion to some people because they know they have people of many faiths. But we do have religious hospices. And now those ones, I think that it's only for religious people. I've never seen an atheist who willingly went to a religious hospice. But religious people do what they want. So I wouldn't really say that we can take that away from them. But what I will say, it's that, just as Moriki said, people work differently. It varies from person to person. Probably person A needs that false hope, that, there is life after death, probably God is waiting for you and all that fairy tale stuff. Probably they need that to feel better, in as much as they know they have less than 6 months. But
just because someone somewhere, just because they believe in their life, sort of gives them comfort, and you can't take that away from them, because anyway, it's what they want. Just let them have it. So if it's religion, if it's prophet or word, let them. It's okay. And even atheists will probably have their own coping mechanism, not just religious. Probably they will want to, see sightseeing, and just hanging out with friends and family. It's okay. Just let them have it. There is nothing wrong. And in fact, the the best thing you can do to someone with terminal illness, it's just give them their own dignity. Even if they're overly religious, just let them have it. It's just being a good human to one another. Because even if it's yourself, you are an atheist but with terminal illness, and you tell them that, you know what, I don't want this religious stuff around me, probably they might understand you. They might take it away from you. So I think it's just being a normal, an upright human being. Let's just use those words there. Okay. Now, when it comes to the steps that I will take to, to steps of letting go, I think that's what Maruki you had asked. First of all, I will start to acknowledge the reality of the situation. When it's me, or when it's me telling my clients that, probably they have less than 6 months, but like, people cope differently, and it's still similar to the stages of grief. If there are people who are familiar with it, the first one, it's like 5 stages. We have denial. People will deny, and then there comes as a stage of anger, where they will be angry, probably ruining their relationship with their partners, their family, because when you're being told, or when someone has been told they have less than 6 months to live, or they're terminally ill, we can't really downplay the psychological effects it has. And people, come to terms different. Someone will go get drunk because they know it's probably the last cup they go and drink, and then they overindulge. People are different. In short, people are weird, and it's okay being weird. So people will cope differently. So after anger, they have bargaining. After bargaining, now they get depression, and then finally they accept. But people do that differently. Someone might, come to terms within a month. It might take them even 3 months into it. So people are different. So once they acknowledge the reality from the diagnosis, the prognosis, when they know the prognosis is poor, probably it's an end stage cancer and they have less than 6 months. So people move differently. The second step, it's to you yourself, probably as their friend, their neighbor, their good, probably relative. You should understand the emotional landscape over them. You should understand people have their emotions. People don't have the same emotions. Probably to you, you don't see like it's a big deal, but the one who is affected, they feel the weight, the full gravity of the situation that is taking a toll in their life. So some might not even eat. Some might get angry, sad, depressed, everything. So this is a place where personally I will take, I will usually treat them with care. Then the third step, I will encourage honest communication, because even not just as their care provider, even as their friend, you know, I wouldn't really start talking about, you will get well soon, because yeah, they won't really get well soon. But what you can do is to tell them, or maybe try to minimize the suffering they have, make their less time comfortable. Like, you don't just treat them like, like they have a year. Like, give them that extra good treatment, but don't do it in such a way that even, it's like, I know people react differently. There are some patients who might feel that, it's like you're telling them that, hey, it's like I'm dying tomorrow, so don't be too overprotective. Yeah, there are some who will tell you that. So it's very important to understand, to know your person, to know your friend, know your, maybe your patient, or even your relative, to know how they will approach it before starting to, start to initiate that honest communication. You should be careful, because again, you are a critical thinker. You will know the right point where you will start to bring that up. And then you can also start to put the issue of hope. This is where hope is very important. In as much as some people are of the opinion that hope is nonsense, I know, and all that, but in this context, where it comes to, letting go, yeah, hope is very important here. Because instead of hoping for cure, you have to hope for comfort, where you don't even hope for a miracle, you hope for peace and less suffering, because it's less than 6 months anyway, so they die. But the best you can do is, just give them hope. Like, for comfort, it will end. Like, it's not being sarcastic, but I think you're getting the point where I'm trying to say. Then I think apart from that, just also there's also things like end of life care, like after they die, or if you're expecting that, like they should be aware of that. Like, how would you approach it? If it's someone wants to get buried, they want to get cremated, it's still part of it. It's still part of palliative care, end of life care. So I will say those are the steps I will take. So, and then to let go of them, like, it's okay because you're preparing, even them, they're preparing to, they'll die. So you also have to psychologically prepare yourself if it's your family member. So that's why I said letting go shouldn't mean even just pulling the plug. It means that you're probably psychologically preparing yourself. Probably in the next 6 months, you won't have probably your friend, your parents, your relative, your patients. Like, it's still part of preparing yourself to let go. So that's what I'd say. Yeah. Thank you.
Thanks, Eugene. El Maestro. El Maestro.
Okay, on Dorcas' question, I think it is not that an unreligious people they let go too soon, but it is because they find it easy to let go. It is not that they let go too soon. It is because it is that they find it easy to let go. They are not too attached like the religious people are. They find it easy to let go because they know death it is inevitable and there's no life after death. So even if you die at 50 or you die at 90, it won't make any difference. So I wouldn't say it is letting go too soon, but they just find it easy to let go. Maybe religious people. I still wonder why they still prolong the life of someone who maybe because also because they believe in miracles, and religious people in religious people they don't believe in miracles. If something is bound to happen, they just accept because miracles. Yes, yes, a miracle might happen, but very rare. So since then the religious people they believe in miracles and others don't believe in miracles. So that's why they find it easy to let, not that they let go too soon. They just find it easy to let go. So and also no, it is unlike the religious people. Maybe so sometimes I think they find it hard to let go. Maybe because they also scared they know this loved one of theirs, he might have been a sinner, so they don't want him to go to hell very soon. Maybe that's why they can do everything in this world to just make them continue living. Yeah, that's what I can say. It's not about letting go too soon, but find it easy to let go.
El Maestro, thanks. El Maestro, is it fair to say that needs research? We can't say, just a question, we can't say that religious, non-religious, they think this way. Can I say that it needs research? Is that a fair question? You have to research on that.
To research on wait,
On
research
atheists,
on
like, yeah, if they let go, to say that atheists let go quicker than people who are religious, can I say that needs research? We can't know for sure that atheists let go sooner and religious let go slower. You have to research on that. Is that a fair question?
No, that doesn't mean. I don't think it needs research. That is just logical. It doesn't need researching. That is very logical. The way okay, I don't need research, but I can just tell from the way the atheist reason to the way religious people reason. You can just tell who will find it easy to let go.
Okay, fine, thanks.
It just needs logical reasoning when you compare their ways of reasoning.
Okay, fine, thanks. Juliana?
Yeah, thanks everyone. That's a very interesting discussion. So to answer Dorcas's question, I don't know that all atheists let go easily. I think it's Muroki who said it depends on a person. Because I think there's some atheists who will want to hold on long, especially if they can afford it, just in case they can stay alive for 10 years and technology changes and then they can be healed. But having said that, it's probably easier as an atheist to look at death in a different perspective. I'll say we're probably more pragmatic. Someone talked about you just critically look at the situation, think about it. You say, okay, I'm going to stay alive. It's costing my family $100,000, 100,000 Kenyan shillings a month. Is it worth it? Whereas if I was to go, then that money can be used for something else. So perhaps we arrive at those decisions earlier because we are not tied up to a superhuman being. It's interesting that El Maestro said that they're waiting for the sinner to be saved. So that's why we'll keep him alive long. And that's very, very interesting. And having said that, I recall talking about atheists who let go. One of our friends, her name was Betty. She was diagnosed with stage 4 cancer of, I think, the stomach. I can't remember what it was, but it was really bad. She did the first round of chemo. She was okay, but then I think it came back. The second time, she said no. She told the doctors, I don't want any chemo. Give me how many months I have. I think she had about 6 months left. She said, okay, I am going to enjoy these 6 months. I think Richelle talked about hope and everything. So what she did for those 6 months, her and her husband, they traveled everywhere. They could afford it. I mean, they were retired and they had some money. So they went to China, they went to Africa, they went, like, she lived, literally lived. And not only that, she planned her own wake. So we all got invited to a party. She planned, we had cake, we danced, we celebrated, and she gave a speech and said, possibly by next week, I'll not be alive anymore, but let's celebrate. So that's such a smooth way of letting go. And not only that, she had planned her her celebration of life down to the last minute. She'd done the PowerPoint slides, the speeches. She'd picked. She was actually an atheist, so we had one of those atheistic type services that was just beautiful. And I thought when I went through all that with her, and I thought to myself, that is how I want it to be for me. And from that day, again, I became pragmatic, logical. And so Doc has talked about writing a will. Yeah, I went out and wrote a will and I said, this is what I want. My last date, this is what I want to be done for me. And when I go, this is how I want my celebration to be. And so I don't think it's that artists like to give up sooner, but I think we're more pragmatic. We sit down and think. I would like to think we are, because that's why we became atheists, because we looked at things and we said, doesn't make sense. So hopefully, with atheists, we look at the fact that I am sick, I am dying, it's costing my family money, etc. What can I do? And just live the rest of your days joyfully, associating with the loved ones. And then when you go, you go. That's what I can say for now.
Thanks, Juliana. Sisema Kula.
Uh, I want to take a stab at Douglas's question, but have come up as well. First of all, one of the things that arise from what Douglas has said is, how soon is too soon? When you say, do atheists let go too soon, what do you mean by too soon? When is it too soon? Is it too soon when you still have hope of change? Is it too soon simply because there is no hope, but you can maybe add another 3 days to their life? How do we define too soon? I think, and atheists are not immune to this.
Maybe Docas can answer that. Docas, by too soon, what do you mean by too soon, Docas? What did you mean by too soon? Maybe you can clarify. Docas, too soon meant?
Too soon to me. Too soon to me is giving up before seeking any medical redress, because even though it is an uncurable illness, there might be some things which modern medicine can do that can prolong your life. So you give up even before attempting any medical intervention because you've had, this one has no cure. It's cancer. So I'm not even bother at all. Yeah, that's how I understand it.
So, doctors, you mean not taking any steps to save life? Eh? You mean that not taking no steps at all? Just saying that this person is sick, let them go. Taking no steps to keep them.
Yeah, but not just any illness. It has to be an uncurable one. Like you've gotten the diagnosis that you have cancer or you have some other condition which has no cure. So you don't bother at all to take steps, even though there's something that can be done to at least elongate your life slightly.
Okay.
Yeah.
Simakula, is that clear? Simakula, yeah.
That's not clear, but I understand where you're coming from. I'm not saying it should be made even more clear than that. I don't think it is possible. I understand where you're coming from. But then that raises up the question what about something like quality of life? Are we looking at life in terms of quantity? How much longer do we have? Or are we looking at life in terms of how much better do we live? I think Juliana is one who sort of mentioned it when she was talking about her friend. By the way, I'm a humanist celebrant, so if you need to do your funeral in advance, you can still talk to me. Anyway, other than that, when she was talking about her friend, I think that to me is a more pragmatic system. It's not an issue of how long do you live, but I think it's more of an issue of what's the quality of life that you have while you're alive. I could extend my life for another 2 months and live those last 2 months in pain. Is it really worth the bother of extending my life? A lot of atheists, and I don't think it's limited much as we all seem to think we're uber rational and all that kind of thing. I don't think it is limited to just the religious people. But even a lot of atheists have the same problem of attempting to prolong life, to keep life longer, even when there is no hope. Some of them will even go through periods where they are literally suffering for the last few months of their life simply because there is this perceived feeling that the longer you live, the better it is for you. So I think, and I'll not say atheists give up too soon because it's not all atheists. I'll say rational people will tend to weigh more than just things like quantity of life, and will even include such things as the quality of life and the effect it has on the society and people around you, because we usually are more than one, in the sense that you probably have brothers, sisters. Of course, if you're a complete loner, that's a different story. But most people have brothers, sisters, friends, colleagues, work and stuff. You tend to weigh more about the impact of your fighting to stay alive, both on yourself and on the society around you, and you make more better decisions more rationally, rather than follow the issue of let me fight on as long as I can, regardless of whatever costs and stuff it is. I think, and like I said, I wouldn't say atheists per se, I would say rational people per se. Not necessarily atheists. Not all atheists are, unfortunately, rational. I'll not mention Mr. President, but yeah, you get my point.
Thanks. Chuleli, you want to add something to that?
Yes, I would like to add some. I mean, not to add something. I would say a totally different but related point to what Dorcas would say. In terms of when when she defined as soon, what is soon when it comes to terminal illness. So my take, I will say that, you know, you won't really blame the patient for, you know, for giving realistic hope, just as I think Semakula has said that, you know, just probably rational people tend to do that. Yeah. For instance, when we were talking about what terminal illness is, you know, first of all, it's incurable and irreversible damage has been done. So you wouldn't really expect such a person to, you know, still have a sort of hope of trying to seek treatment for getting better. They will only be lying to themselves, because even medically speaking, they won't get better. They will never get better. So that's why I will say it's sort of better to advise them to go to palliative care or palliative medicine or hospices or all those things, because again, they have a sort of philosophy that sort of they have a sort of philosophical care and all that practice that they will tend to benefit from it. It's not, you know, when it comes to palliative care, it's not about prolonging their life, because it's definite they have a short time before they go. So it's more of, you know, all hope is lost about finding treatment, because no one goes to palliative care to find any treatment or any cure. Everyone in palliative care goes there because, you know, they want to sort of make their suffering less, but their short time still remains. It's a constant, because when a prognosis says that you have less than 6 months, it's whatever you do, even if you scream, even if you go and get drunk, even if you know, walk naked, those 6 months are constant. Nothing will change about it. Even if you go to the Himalayas, to the Buddhas, even to the Buddhists, and then they tell you that you will extend your life, they will only be lying to you. So the palliative care, it takes a different approach. That's why I say they will tend to benefit from it, because it's all about, you know, minimizing the suffering and making their comfort, their less time, more worthwhile. Maybe even if it's just making them see their family, their loved ones, you know, hanging around them, you know, just it's all about human dignity, and it sort of aligns with secular humanism, because it has nothing religious. It's not about selling false hope, but it's about being realistic about what's going on and coming to terms with what you can do, and then leaving what you cannot do, but just making their suffering less. So yeah, it sort of makes sense. So I think when it comes to terminally ill, it's not about, you know, so when you find someone wishing that, it's not about they want to prolong their time, but yes, people, it's we can say it's a humanistic urge. It's a truly honest humanistic urge. Everyone, most people actually fear their own demise. They fear their own death. So they will sort of have hopes, even if they will lie to themselves, that they want to extend their limited time. And you won't judge them. It's a human, we can say it's a human instinct. There's nothing wrong, or you can't guilt trip that urge. But again, when it comes to terminal illness, like one who is rational, they know that they can't extend the time. So they will tend to benefit from palliative care. Even if they're atheists, they will travel the world. Like, for example, Juliana's friend, like they can do that, but still they can still take palliative care concomitantly, yeah, simultaneously. So there's nothing wrong with that. So that's what I would say.
Okay. Before Stano speaks, Doc's question answered. We want to move on to business. Has the question been answered completely? Are you satisfied with the answers?
Yes.
You are. Okay, Stano. So we can move on to business. Stano?
Okay. Mine is also a question. So about giving up. So we are talking about let it go. So what about I'm totally ill, but my family are doing all they can, doing harambe to raise my medical bill for me to be treated. Yes, there is hope I can be treated, but I'm seeing my family relative are struggling, trying to raise those millions without success. Will I let it go, or how can we view about that? Because that is the financial limitation, or maybe we are the relative, but we are struggling, but we decide to give up, to let it go, because we cannot be able to raise that kind of amount after we have struggled without success. What is your perspective about that?
Stanley, are you asking the family is struggling and they can't reach the target? Will they reach or they won't make it? And the person should be able to go on then. Will he survive if they get the money? No. Will they survive?
Yeah,
if
there is maybe there is a chance of surviving. Let's take when there is chance of surviving, and
okay.
we can answer this question in two types. One is when we don't know whether there is a chance of surviving, and the other one is when we know there is a chance of surviving. We don't know, and the other time is when we know.
Yeah. So for me, an answer, if we know, definitely get the money. If you know that if you get this money, this person will live on with their life. Keep on doing it. But if you don't know and it's very expensive, I think let it go. That's my take. So I don't know what you guys think about Stano's question.
So
what do you guys think?
I'm saying like this. For example, I'm saying like this. For example, the family decide to sell everything they own to get the medical bill, but even after selling everything they own, they are unable to reach the target. So they try to call for a lambe, yet they never get to that target. When is the time to give up? That is what I am trying to refer.
Okay, fine, thanks. El Maestro, you can answer. El Maestro. El Maestro.
Juliana and Semakula have just talked about this thing about quality of life. You know, now if I don't know if I don't know about other people, but if it was me, who my family has, my family wants to sell everything so that I can stay alive. But now when I finally recovered, now what about the quality of life you live after that? You've lost everything. You've lost everything just to keep you alive. Now you'll be you are it's like you are starting life from zero. Those people who maybe somehow in some families they might have friends who maybe uh, will help them. Okay, but if it means but wait, the thing is, if you've already sold everything and it's still not enough, how will you bring back your life to normal after maybe you finish this treatment and this person is at least doing the, how will you now bring your life back to normal? Your life will be completely like you are starting life from zero, and but now then it depends also where you are born. Like here in Africa or in Kenya, starting life from zero is very, very difficult compared to maybe other Western countries, some other Western countries. For me, just do me a funeral and continue with your life. Why should my life continue living everyone else's life, taking it back to zero? For me, it is not worth it at all. It is not worth
MS, what I'm hearing, but if you're wealthy, it's okay. But if you're not wealthy, let the person go. Yeah.
If you're wealthy, why have you sold everything? And obviously, if you're wealthy, then it's fine. But now, if you have sold everything and it's still not enough, it's not worth it.
Okay, thanks. Okay, guys, we need to move on. Be brief. Juliana, 2 minutes.
I think Dorcas's hand was up before mine.
Oh, sorry. Okay, Dorcas.
Yeah.
Be brief, Dorcas, because we have to go on to business. Then just be brief. Thanks, Dorcas.
Okay, so let me first respond to my question. And I asked you guys whether irreligious people or atheists tend to be more likely to let go too soon. And I think my answer is in close association to Morioki's. I would say that it depends, and maybe we need to do some research. I don't think we can categorically assume, as El Maestro did, that all or most atheists are objective or rational, or that most atheists don't cling onto life as much as religious people do, because there's another school of thought. You see, there are the people who, there are religious people who cling to life because they think all life is sacred and it should be preserved at all costs. But then there are atheists who might cling to life even when there is no hope for recovery, because they believe that this is the only chance we get. There is no afterlife. So I want to live as long as I possibly can, even without considering the quality of life involved. So that crop of atheists might not let go too soon. They might seek medical redress as much as possible. So that's my response there. Now, in response to ex-Pastor Sano's question, I think he's introducing a scenario that might be slightly off topic because it does not pertain to it does not pertain to terminal illness, because terminal illness must, by its definition, must not have any hope for recovery. Like, it's irreversible. You're gonna die. That's a given. That's why it's called a terminal illness. So if you have a terminal illness and your family members are selling their cows and they're selling their land in order to save you, then it's an exercise in futility, and I would really discourage them from doing so. But if it's not a terminal illness, it's the other situation he presented of where there's a possibility of survival, medically speaking, then why not let them conjure up their finances or their assets and intervene in that situation? Why not? Thank you.
Doc, as El Maestro says, you go back to zero. That if the person survives, you go back to square one. That's what El Maestro said. What's the point if you go back to zero? You sell
Who
your
will
land.
go back to zero? The family
members.
of
Yeah. You go back to, you have to start life from zero. Like El Maestro said, is it worth it? Even if they survive, okay, they've survived.
That's a question.
Back to square one.
Let me add it. You'll go back. You start life from zero, and you'll still die anyway. You'll still die anyway.
Maybe. Well, I don't think it's. Maybe this is a question that they have to answer, because maybe they see a lot of value in this person, that they are being alive and being present. Maybe they see value in it that is removed from their finances. So they will start. They'll go back to zero, but they will climb up together. Who knows?
Juliana.
Yeah, thank you. To answer Pastor Stano, and just to put a twist on it, Doka said terminally ill. Okay, I'll get an example. My mom was diagnosed with stage 4 esophagus cancer in 2016. So that, I think, is a terminal illness, because that's one of the most stage 4 is stage 4. And so what we did is we didn't we fundraised from the family to pay for her chemo and radiation. And it took months. And of course, I paid for any time it was a chemo treatment, I had to pay. And I told the family, you just get her to hospital. So it was a lot on the family. So in the case of Stano's question, do you stop fundraising? So at that point in life, I couldn't think of letting my mom go. I did what I had to do. Even then, at that time, I did not have a job. I was in between jobs. So I used all the savings I had. I yeah, I used all the savings I had, and so it looked like it was going to be okay. But then, guess what? She passed away about 8 or 10 months ago. Now, if I had to go back, would I do the same? I probably would. It's so hard for me to stop. So I think it depends on the fundraising on when to stop. Now, if it was me, if I was the one that was diagnosed with stage 4, and I see how much my family is suffering just to raise the money and selling and not going to school and all that good stuff, I would say, you know what, folks, let me go. Help me to pass away. I think Eugenia talked about euthanasia under the table. Luckily, in some Western countries, it is legal, especially in Canada. They just passed a law. It's called MAID, medical assistance in dying. There are a lot of protocols around that, but I can do that. I can go to the doctor and I write down something. I'm of sound mind and I want you to help me terminate my life. That's what I would do if it was me and my family was fundraising. However, in my mom's case, she was the one who was ill. We were fundraising. I would have probably continued doing that. And actually, what happened as a result of me using the savings, it forced me to go back to work because technically I had retired. I said, you know what? I am done work. I'm just going to do part time. But all the savings I had were going. And so, because I spent all that money on my mom and then she passed away on the funeral cost, it forced me to go back to work. This was in 2017, and I'm still working. So if I was a Christian, I would pray and say, oh, she passed away, but her death was not for nothing. At least it forced me to go back to work, and now I'm okay. But yeah, so it depends, Stano, on what side of the fence I'm sitting on. Am I the person that's being fundraised for, or am I fundraising for a loved one? Thanks.
Okay, thanks, Juliana. Eugene, 3 minutes, 3 minutes.
Yeah,
We're running out
sure,
of time.
sure. So to respond also on Pastor Stano's question and El Maestro's take also, I think just as Juliana said, it depends, but in that context, most of the time, but ideally, how it should happen, even before the starting of the fundraising itself, what usually should inform all this process afterwards, whether it's fundraising, seeking out the funds for the treatment, is usually the prognosis. The prognosis usually means the medical outcome or the picture of the illness, if there is any hope of, a good outcome or a bad outcome. The bad outcome there, obviously, it's death, and the good outcome is at least probably some quality of life there and some improvement at least. But that's if we're not talking about, if they're not within the constraint of terminal illnesses, because if they're in the constraint of terminal illnesses, we won't really be talking about treatment and cures, right? So in Kenya, most of the time, what usually happens, because due to what I've seen, it's due to the health inequalities. You might find that because of the constraint we have, you might find that most of the time it's the children who are probably diagnosed with some cancers which haven't really advanced. Not just even cancers. Some kids also have some kidney disease as well. Now, when you look at what usually kills these patients, it's usually the complications. And ideally, to avoid these complications, is to seek the treatment. But the fact that you are in Kenya, most of the time this treatment is usually expensive. So the system sorts of make some of these previously treatable conditions, it transforms them now into terminal illnesses. Case in point, you might find there's a lady who maybe has maybe stage 2 cervical cancer. Stage 2 is usually treatable, but it's expensive, and probably if people are far from the facility, now they stay at home because they don't have the funds due to their socioeconomic status. Now the cancer progresses and becomes stage 4. Now, what usually would have happened, you might find that they will start to have to fund, they will start the fundraising. And the truth of the matter is, it's known that when it's stage 4, whatever treatment you have, the prognosis is usually poor, but like you won't really recover from it. It's a terminal illness. So we don't have an ideal picture in Kenya as we might have in the West. But if there's any hope, for instance, if you're not in any terminal illness, probably as El Maestro had asked, would you really maybe fund if there's any hope, and if there's no hope, would you really pursue the treatment? I would say number one, the prognosis should inform my decision. If the prognosis is poor, definitely, even if I raise the treatment funds to 24 million plus, but they won't really recover, there's no chance of recovery, there's no point in doing that. So what you will really be probably going for, you will be probably trying to raise the funds for palliative care, because the outcome is bad. You can only make them comfortable with the less time. Yes, it's not usually an abrupt decision. It usually takes time, because, as I said earlier, people take time to process breaking news different. That's a bad breaking news will breaking to someone, so it will take time. So now the second scenario, if there's a chance, if the prognosis is good, probably if it's a child with chronic kidney disease, they can't afford probably the funds for dialysis, but collectively as a community, we can fund them to go outside and then get a kidney transplant. So there's a good chance they might recover. So why not? Why deny them that chance? Because it's all about hope. If there's any hope, informed by by the actual chance, because chance is something like you can actually calculate or probably see the probability of the outcome is good. Why not pursue it? It's only logical to do that. But what usually informs such a decision is usually the prognosis. If there's a good outcome, yes, go for it. If not, then think otherwise. Think palliative care. Think something else.
Thanks, Jean. Thanks, Jean. Stano, you're good, eh? Stano, you're good. Stano.
Yeah,
Okay,
I'm okay.
Okay, fine. Now let's move on to business, eh? So about letting go for business. Now, the first question is, when do you know that it's time to let go of your business? Like suppose you're making money, you're making good money, but when it comes to Monday morning, you don't want to go to work. You're making good money, but come Monday morning, you say, I'm going back to work. Then on Friday, you want the week to go fast. So that the weekend comes, you off your business. Yeah, you don't want to be there, as in the money is good, but you don't want to be there. Is that a sign of failing? And then on the other hand, maybe you're making little money, but you like what you're doing. Yeah, you like what you do, but it's not much. Like maybe it's a kiosk even, a kiosk class, small kiosk, but you like what you do. Yeah, so is that a sign of where is the failure there? Is it the rich guy who has no passion and he's not enthusiastic, or the kiosk owner who likes what he or she does? So now, is there a failure there in any way? Is there a failure in the two cases? Is there a failure there? Thanks. Hope I was clear. Like if somebody has good money and they don't want to go to work, is that a failing business? And the person who has a kiosk has little money but likes what they do. Yeah, is there any failure? Can you sense any failure there in the business? Can the rich guy say, I want to stop this business because I don't like what I do despite the money? Okay, Dockers. Dockers can go.
Okay. I think it's very important for us to consider, why do we start businesses? A business is a profit-making entity. If you're not making profit, then you are not meeting the ultimate goal of a business. So I believe when you are making losses, that is failure. That's a standard understanding of business failure. Like, you can't sustain the enterprise. It's not creating any profit. It is actually draining money from you. Then what's the point of having it in the first place? You need to close shop. You need to be honest. with yourself. So if you're not making profit, if you're making losses, you're getting into debt, then that is a problem. I remember my friend who owns a chips shop somewhere in Kino. She likes to share with me lessons on what people do wrong or right in business. And she was telling me how there was a neighbor who started a shop and alikuja na fujo. Alikuja akaeka furniture. No, they furnished that place thoroughly for 2 weeks. They were just furnishing. They painted interior design. Fujo. But then 6 months down the line, they closed shop. Why? They were making losses. They spent too much money in setting up the business, and they were not making enough money to handle the expenses. So that was definitely an issue. And to me, that should be a sign. If perpetually you are making losses in your business, that should be a sign that you need to let go. Now, when we move beyond profit, sometimes you can make profit, but the amount you're making is so small that it's not enough to survive on, because the business is supposed to take care of you. You maybe have children, they need to go to school, you need to be able to pay rent in your own house besides the rent you're paying for the business. You need to be able to do all these things. And if your business is not able to achieve that in the long run, because maybe at the beginning you're trying to break even, you're trying to understand the market, so it's good to weather the storm. But if perpetually that is the case, that you're making such little money, you can't afford to go to hospital when you fall sick, you can't do anything, then you might need to reconsider whether entrepreneurship is for you. Maybe you are better off as an employee. Now, the last point I'd like to make on that, on when to give up on your business, it touches on the scenario that Morioki painted of the person who has a small shop, but they enjoy going to the shop, whereas there's this rich person, they're making a lot of money, but they're absolutely miserable. I think you also need to consider that component, because you don't want to spend most of your time. Your business is something that will take up most of your time. You don't want to spend it in something that causes you misery. You don't just chase money for its own sake, that I'm going to chase money at all costs, even if it is going to kill me inside. No, I think when you are absolutely miserable. There's a lady I watched who is an artist. She's in Luchaveleli's group here. She's a painter, I think. Okay, she used to be a painter, but because of digital technologies, she uses those. She does animations, and she got a comic book contract. She got a comic book contract for a certain period of time. It was going to give her a lot of money, but she hated it. She hated it. She was supposed to do how many pages? She only did less than what, 0.5% of the pages. She absolutely hated it. She couldn't stand it at all. And even though it had a lot of money. So she decided to go back to a 9 to 5. So yes, I think we need to consider that aspect when we're looking at our businesses. Kwa hayo mengi, wacha niachie hapo.
Okay, thanks, Dorcas. Okay, anybody else? When do you realize that your business is not good for you? Is it just the money or the enthusiasm? Yeah, or both? When do you realize that this is for me or it's not for me, or let me let go of this thing, start working despite the money, or because there's no money, I let go. Anybody else, when did you realize that it's time to let go of this business? Is it the feelings, or just the money, the profits, or the losses? Like maybe Eugene, as a doctor, when do you see that? Is it just the money? You like helping people, or what? When do you see that it is not for me? I'm in the wrong career. Is it the money? The thing, the need to help people. Yeah, Eugene.
Well, well, I think I can still approach it from a business aspect in here, because I think anyone can at least can still easily understand business. I'm assuming so. If I'm approaching it at a business perspective, I'd say that yeah, while we have some facts out there, like even if it's a start, like 90% are non-paid, and probably mine, even if it's new, it might be along it, and it will fail, it definitely will fail. I will say that I wouldn't take it as a setback. So I will, in as much as I will let it go, but I won't really give up. I will take it as a learning opportunity. I will try and find out probably why has it failed. Is it because I didn't do my background research about kind of business I want? Is it because I didn't, hire the right people, or probably use some, the right skills in that particular business? I'd even end up being more curious than giving up as a whole, as in, why is that? Why did that happen? And take it as a learning opportunity, probably, so that the next time I try to start up something, I will make corrections and see how it might fare on. And probably if it will fail again, people are different. Again, I wouldn't really give up. Number one, I don't really give up easy. And even when it comes to healthcare, it's still the same. As in, when I'm trying to treat my patients, probably in things like medical, and you're trying one approach and you see it's not working, you don't just give up and you let go. Like, you take it as you try and understand why has it done, and you adjust appropriately. I think that's the beautiful thing about growth and learning. It's a continuous process. So even if when it comes to business, in as much as I will let go, I wouldn't really abandon the idea completely, but I will be more curious as to why things happen the way they do. So that's what I'd say.
Okay, Eugene, in your profession, do you guys consider death like failure? Like if a patient dies, is that considered a failure?
Now
Like somebody young, somebody young, not
it will
old,
depend.
a young person.
It will depend. We don't usually have preference. Life is like, even if it's a 90-year-old man dying in your arms, and a 5-year-old kid and a 6-month-old baby and a 2-day-old baby both dying, it still has the same gravity, because all lives are the same. Like, we don't have preference. So that does occur. It's a common thing in the nature of work. But now it depends. For instance, that can happen due to a number of reasons, from the condition itself, from the prognosis itself, from the treatment itself, and even the competency of the healthcare practitioner. So when we have a death, we normally do things known as mortality review meetings, and we try and find out why did they die. So when there is evidence that probably the fault was on our side as healthcare practitioners, investigations are initiated. So, and there's usually disciplinary action to whoever is found culpable for such acts, whether it's negligence, whether it's maleficence, and probably whether it's legal action and all that might take suit. But yes, that is not a new thing, it happens, but we first have to establish why did it happen. And probably if it's due to the condition itself, then no one is usually implicated, or no one is vindicated. So it's understood. So it actually depends on why it happened, but we don't have preferences. Like, it's better to lose an infant than an old man. No, we don't have that mindset.
Okay, thanks. Okay, last question. And in your career, how do you view loss and profit? As a doctor, how do you guys view, I made a loss here or a profit? How do you guys do it?
Now it actually depends. If you don't own a clinic, if you don't own the hospital, you're just a cog in the wheel. Like where I am right now, I don't own a facility. I'm like a cog in the wheel. So whatever profits the facility makes, I have nothing to do with it. I'm only interested at the end of the day whether it's my local pay and everything. But now when it comes to now the owner of the clinic or the pharmacy, or it's now that's them. Now when they make profits, they will usually appreciate. Now it's them, and then it might also affect how they will treat their patients for obvious reasons anyway, whether it's for the good or for the bad. I mean, for the good or for the bad, it happens. But right now, I can't really say anything because I'm a cog in the wheel. I'm not owning anything.
Okay, thanks. Sasa Makula, when you let go of a business, when you realize that this is not for me? Sasa Makula.
I don't. With business, I don't really realize that this is not for me because I don't think you can honestly say you have failed in business per se. I think you can only say that this particular phase is not working, so you need to look at a different way of getting the whole thing. Unlike many other things, businesses are not like terminal in the sense that a specific failure means it can never ever happen. So I would say I shift gears when a certain path is not working, but I wouldn't really say I have learned how to fail in business. Yes, I haven't succeeded yet, but I can't say I have learned how to fail either.
Okay, thanks. Stano, how about you? Stano, when do you realize that this thing is failing, you have to let it go? Stano. Stano, are you there? Okay, Juliana, when do you realize that this thing is failing, you have to let it go?
Actually, at this point, I think I'm going to go back and borrow from Dorcas, where Dorcas says that, well, the question that Dorcas had about non-religious people giving up too soon. In this case, I'm going to say people give up too soon, generally. And if it's something like a business, you should never, first of all, you should not have gotten into that business without thinking of the implications of how long it profits. So I see a lot, especially my family. They will get money for business. They're in there 6 months. Everything's gone. They're starting another business. They give up too soon, number one. And number two, they don't, I think they have this perspective that I have a business, therefore, all of a sudden I should be able to afford to eat meat every day. No. When you have a business, there are some lean years. And if that means you have that business and in the evening you're going to work a different job, I don't know, watchman or something, just to keep the business going. The business has to be there. People have to see that business for a while to trust it so that you grow your clientele. But we give up too soon. So I think was it Semakula who said they don't give up, and the Cheveleli? Yeah. I think if I was to do a business, I would never give up. And first of all, I would have set aside some money that says, okay, this is the money that I'm going to use if I don't make money from my business, i.e., if I have to send a child to school, if I had kids, if I had to go to a hospital, this is what's going to happen. This is the money I'm going to use. If I can't do that, then I have no business having a business, because it's like I'm throwing all my eggs in one basket. And when that basket falls, everything cracks. Instead of setting aside some eggs that I can sort of hatch slowly. So we give up too soon in this case, people do. 6 months is too soon for a business. In fact, I don't know about Kenya, but here in Canada, they say a business has to sustain itself for at least 3 years before it becomes viable. So for those 3 years as a business owner, you are probably working 2 jobs. You're probably living in your mother-in-law's, you're living with your mother-in-law, like you're doing your best so that you're building your business. You don't give up. You don't start living large, expecting money. And of course, you'll not make profits, but you'll have to account for that as you do your business plan. saying, if I don't have money, I have to be able to at least pay my business taxes, at least pay my utilities, at least pay for my license to get my business going. Because people need to see a business that's sustainable for them to trust and start coming to you and hence be your clientele. In this case, we tend to give up too fast. We should never give up business. And for me, I'm not a business person. So I won't even try it that way. I'll just do a 9 to 5 job because it's too hectic. But I'll help, but I won't be the one that will set up that business. In this case, we give up too soon. We have to sustain for a longer time to be successful. If you look at all the successful millionaires, they didn't give up, they just kept going. But we give up too soon and then we blame people on our lack of success. Thank you.
Okay, thanks, Juliana. Okay, last question on business. Just these are hawkers, mambogas, the guys who sell sweets in town. Are they failures or not? Can you call them failures? Just a question. The mamboga, the hawkers, the guys who sell sweets, are they failures? Are they failures? What do you guys think? Okay, Simakula.
I'm not quite even sure why you would even look at them as failures. They are running a business. They're making money. They may not be making millions or trillions, but they had to start somewhere. Every single business, even the so-called richest man in the world, much as he had so many millions from his parents, he started somewhere. I mean, at the end of the day, you go out there, you do your business, you make whatever profit you make, you either invest it back or use some of it for your own things. I would say you're a successful business if you keep going. I mean, even as of us who go 9 to 5, uh, Juliana says she's not a business person, but if she goes 9 to 5, she's a business person. She's selling her labor to somebody else and making a profit from it. I don't see how you even think there could be a failure.
Just a question. I'm just asking. Doctors, what do you think of hawkers, mamboga? What do you think?
So what is your assumption? Why would you consider them to be failures?
No, I don't consider. I just asked a question. Yeah, because they look like they have no office. They just stay outside. Yeah, it looks like a very small business. But I would say I didn't say they are failure. I'm just asking your opinion, because like if somebody with a big office or somewhere like that looks well, I don't know what to use. They just outside on the streets selling sweets, nini. So I don't know. They're okay.
I think
just a question. Yeah, just a question. Yeah.
They are fine. They are fine. In fact, these small businesses are the reason why our economy is going. Sometimes those big plush offices tend to not contribute much to the economy, or they tend to accumulate a lot of debt. But these small businesses are what are manageable. I don't know what I would do without the mama mboga. Oh my gosh, that would mean either I would have to buy all my groceries from the supermarket, which would be costly, or I would need to walk to the market in Githurai, either walk or commute to the market, and that would be extra expensive. It's just a lot of logistics that they have spared me from engaging in. Or the hawker in the street, the person selling the oranges, the pineapples, the sweets, the biscuits. Sometimes I'm hungry. And there's no time to cook anything. I just want a snack. So it's so convenient for me to buy some biscuits from the roadside. She's offering a very important service, and I don't think that they are failures in any way, shape, or form. If they are benefiting from it because they are able to feed their families, and I'm benefiting from it because I'm able to access products conveniently and affordably, then let them continue. Let them continue existing. Yeah.
Okay, Doctors, what comes to mind? I hate the way they are chased by city council. At times I see them running away, like the ones who sell clothes. Once in a while, you see this city council coming and chasing them. And I'm saying, what do you guys want? These guys, they're making a living, but they shouldn't be there. Let's get them out of here. I don't know. They are chased by city council. Yeah.
Okay, it's just that they have skipped licensing processes, and sometimes you find that these processes are very costly. For the small business person, they can't afford to pay all those licenses, so they prefer to skip, or it could be a location issue. They are chased by Kanjo because they are congesting the streets, and arguably Kanjo might have a point. I think they overdo it. The ones that sell clothes, I think they really overdo it. They cannibalize the aisles or spaces that are designated for us, the pedestrians. And yeah, that could be a problem. But I still see value in their presence. I see value in hawking, in hawkers or the hawking industry, generally speaking. Maybe they just need to be regulated so that we can have less congestion in the CBD.
Okay, thanks. Is it Eugene? I don't know. Eugene or okay, Eugene, go first. I don't know who went first. Eugene, go. Then Juliana.
Okay. I think I think instead I actually have a lot to learn from mambogas and hawkers than I I don't I don't even see it logical to view them as failures. Just as Semakula said, that's a successful business they're running. And I'd say what I'd actually even learn from them, in as much as yes, you've talked about them getting chased by the Kanjos, what I'd pick from that, I think I will pick the art of resilience. Rain or shine, you're being chased by the Kanjos, whether it rains, this kind of people, they never fail to show up for their business, even if it rains. Right now we're having rains, but tomorrow you will have your mama mboga there. And even us, even if we work, sometimes I feel lazy and you skip, or you just drag yourself. But those guys have resilience, and that's actually a thing. If you want to run a successful business, that's a positive trait you want to learn also. And apart from that, I can even talk about they have great customer relations. They know their clients by name, their taste, their preference, everything, even their credit history. Just imagine yourself running a business and you know your clients by heart. Even us in healthcare, sometimes you forget your clients, you forget them. I can't remember 90% of my clients in the last 2 years, but Mama Mboga know most of their clients. So that's something I can actually teach myself, or I can learn from them. So I wouldn't really view them as failures, but I'd view them as teachers, because even that know-how of maximizing limited space, of setting that kibanda and stocking it at a small space, but I will use that trick in my inventory. There are some positive things, very many positive things we can learn from them instead of looking at them as failures. So that's what I'd say.
Okay, thanks, Eugene. Juliana.
Yeah, I totally agree with what Dorcas and Daktari have said. And also Sumakula, those are not failures, those are actually business. It's just that as Kenyans, and I saw this in Kenya, we tend to look down on those types of people. Unfortunately, we tend to look down on people who don't go to an office wearing a tie. I had a different attitude, so I never really fit in with my friends. They would look down on these people. And luckily, when you come to the Western world, especially in Kenya, those blue collar workers, they make more money than those people who go to an office with a tie. So back to the Mambambogas, very, very successful. So one time, one of the things I like to do, is I just like to sit and look at what a person's doing. And so I look at, say, this Mama Mboga. So she's selling her sukuma wiki for whatever amount she's selling it at. So she goes in the morning, she picks it up from the wholesale, say she pays, say, 10 shillings for a bag. She comes and splits up that bag, and then that 10 shillings, she turns into a few bundles that she's making maybe 100 or even 50 shillings. She has made a profit of 40 shillings, probably in an hour. When you slowly count up the value of each item they're selling, those guys have a lot of money. Believe it or not, that's why they're there every single day, despite being chased away by the city council. And first of all, they're giving a service. Absolutely. My nephew tells me when he was a bachelor, what he used to do is he would go to these, I guess they call Mama Boga or something like that. And for his meal, instead of buying dry beans and boiling them for 10 hours, he buys already boiled beans, and all he comes to do is just fry them. So imagine how much money that person is making. They've taken the dry beans, they've boiled them, they're selling them to you at a profit, and you're taking those beans and you're spending 5 minutes preparing your meal. That is a success job. So we should never, ever, ever discredit those people. We should, I think, Dorcas says, just not legitimize, but just ensure that the process of them being on the street is understood, licensing, and is reachable, etc. So one thing, I don't know if you guys have had, and I know my friends, I haven't seen, but I've seen it on YouTube, what some countries, especially China. When you go to China, one of the tourist things is they call them the night markets. So during the day, the streets are free, there's no hawkers, nothing. But during the night, it's open for people to come on the street and sell their things. So that way you control the use of space. And those guys are licensed, so the health things are taken care of, the safety, and that is one of the most popular tourist destinations. When you go to China, you must go to the night markets. So I don't know why something like that can't be done in Kenya, especially those mama bogas towards, say, from 6 to 8, 6 to 9 p.m. at night. Just dedicate a space for them. You say, okay, this is the night market. This is where you come to sell your veggies, to sell whatever. And that way the streets are clear, there are less people, and people are sharing space in a respectable way. So the city council has to think different ways to maximize the use of space and at the same time ensure protection of the public and the hawkers. And at the other side, we as people, as consumers, we have to respect the fact that these people are making a living and they are making so much money. It's just that because it's low amount of money you're spending, it doesn't look like it's much. But when you sit down and add up how much that person takes home at the end of the day, it will astonish you. And not only that, those people do not depend on month end like the office workers. These guys have money every day. Even if it's in the middle of the night, somebody is going to buy skuma wiki, right? And here's the funny thing. Those mama bogas, because they know you, they can give you credit. You're an office worker, you can't afford credit. You say, oh, ndalipa mwisho mwezi. You're getting credit from these people that you're despising. Wow. I think we have to change our attitude towards type of work. But those people are very, very successful, and some of them are very, very rich. It's just that we don't see that. Thank you.
Okay, thanks. Jonah, how is Canada? Are they there in Canada? Such people in Canada, do they exist?
Yes,
On the
yes,
streets
we
of
do.
Canada?
We do have people that sell things on the street, but they have special places where they have to sell and they're licensed. So, like, depending on the city. Now, Edmonton is very cold, so you won't have the markets all throughout the year. But during, I think the markets open in May to October when the weather is good. Outside, they close up a street and they say, this is market day. All the hawkers, you bring your bananas, not bananas, they don't grow here. Apples, grapes, food they've cooked. If it's chicken, they've cooked, anything. They're all there hawking for the day. It's usually Saturday and Sunday, or maybe Thursday. It just depends on the area. But they're licensed and they know what they have to do. They say this is where you put your garbage, this is the bathroom, the toilet, bathroom, everything. Oh yes, they're there completely. And unfortunately, I don't go there because they're actually expensive. I mean, they have good food, but it's expensive. So I go to the cheap grocery store to buy my vegetables because it's cheaper. But if I wanted something unique, that's where I go. Oh, they're all over the place. They're called farmers markets. all over the place, depending on the weather and the season.
Okay, thanks. Smakula, you want to add something? Be brief, just be brief. We're out of time. Smakula.
Yes, I just wanted to point out one small thing. When I still had a car, I was looking at what my mechanic charges me and extrapolating it to what he probably charges other people around the place. Then I remember when I was in school, we used to be told, if you don't perform well, you will become a mechanic. Then when you look at the kind of money that guy is making, then you think about what you are doing with your fancy office and probably fancy title. You start thinking, maybe I should have failed and become a mechanic after all.
So I hear you, sir. Okay, last question, relationships. When do you realize that this marriage or a relationship isn't working? Like for me, I've come to see, okay, my belief is if he or she hits you the first time, just leave. Because these couples who kill each other, it starts slowly. You know, one fight, another fight. Next thing, they've killed each other. So my view is if the person hits you the first time, just leave. That's my view. So I don't know, what do you guys think about relationships? When do you realize that this marriage or a relationship isn't working? Thanks. Juliana, is your hand up now or previous?
Sorry, from previous. Sorry about that.
Okay, fine. Yeah, so anyone, when do you think? Okay, Dorcas. Dorcas. Yeah. Yeah.
Yes, I have heard you, Muriochi. Saa zingine wewe hujirudia. Do you know that?
No, because of
sana.
where I am today. I'm Niko up country, sijali, Niko up country.
Okay, relationships, final question. I think let me focus on a marriage or a long-term romantic relationship. Let me concentrate on that because with the friendship dynamic or even the family dynamic, the blood family dynamic, that's different. It can be slightly different. So, that's my wire. I think you mentioned one aspect, and I think that is the universal one. If there is violence in the marriage, then it's not working. It could be a time to let go. I believe that when your safety is in jeopardy, then you shouldn't compromise on that. That's number one. Number two is addiction. And this could be addiction to substances. Maybe they are into some hard drugs, or in Kenya, it's usually alcohol. And the problem has been persistent. However, some people can ask, when you didn't see this before you married this person? Yes, sometimes it's possible for them to disguise their behavior, or they could develop the addiction later in the marriage. So you all know, we had this Zoom topic on addiction. You all know the repercussions and how you become a slave to your substance of addiction. So it could be a problem. Either it could be addiction to substances or addiction to gambling or other behavioral things that are making the person dysfunctional. Maybe they've sold all their assets, they're not working anymore, they're not reliable, they're lying, they're doing all these kinds of things and just causing misery in your life. I think that could be a sign that it might be time to let go. And then a third one that I would add, and now this one, I see people disputing it a lot in atheist circles. For me personally, cheating. cheating. I am monogamous. And when I'm entering a relationship with you, the implicit understanding is that we are going to be faithful to each other. If we enter into a relationship knowing that it is open, then of course cheating won't ever arise because you are open to the idea of having multiple partners. But once we are entering a relationship and we know that it's a monogamous relationship, then you cheating is violating that contract. And yeah, I personally wouldn't have it. I don't want the idea of exposure to diseases. In fact, for me, that is really a big one. Him going out there, having those partners and bringing for me diseases is an issue. But just that betrayal that he has other people behind my back is really an issue that I wouldn't tolerate. Can I forgive a cheating partner? Yes, I think if the person is remorseful and I'm seeing signs that they will stay faithful, I think forgiveness can be a path to consider. But if the individual is just a chronic cheater, then it's a wrap. It's a wrap for me. I don't think I would take it any further. Oh yeah, lastly, a criminal. Yeah, is a criminal, is involved in illegal activities. There, it's very easy for you to be carried by that tide, to be complicit in the criminality or just to be affected in one way or another by his criminality. So yeah, those are my reasons. Thank you.
Thanks, Dorcas. Eugene?
Hello. Yeah. I think when it comes to relationship, how I usually approach it, I think, unlike a business or unlike probably a terminal illness, this is something that usually has some red flags to look out. Not just marriages, even these other relationships that aren't really marriages. When it starts to take a toll on your day-to-day life, whether it's not just physically, but yes, even that's just one of them. Well, if there's abuse going on, there's some injury, there's some sort of disrespect, some sort of psychological, abuses, whichever the case, but it takes a toll on you as a person or your friend or anything. I think that's that's just enough to call it quits or to probably temporarily end things if you it's usually dependent. But when it comes to matters of abuse, there's nothing temporal about it. Just let go of the partner who's abusing you because it's actually safe. It's better sorry or what's the say. It's better to be cautious and be safe than compromise and hope for them to change and then they end up killing you as their potential spouse or even the actual spouse. Apart from that, if they're giving you some mental distress, because yes, people can actually get mental distress from their partners. Probably they're abusing partners. Probably they're not even physically abusing them, but the manipulative techniques, whatever psychological, things they're doing to them, you might never know. But if it's taking a toll, there's a sign of distress. Just call it quits. Let it go because it's really not. Because at the end of the day, your own welfare, your mental welfare, your physical welfare it's usually given preference over your social connection. You can't tell us that you're good at person skills, but you're not okay with your own intrapersonal skills. So that would be a compromise. So I think once you feel that your personal life is being, it's not that as you wanted it to be because there's some sort of, we can say, we can usually use the word toxic because it's an overused word anyway, but it tends to mean that it takes a toll on your life, on your day-to-day life. It's really not what to pursue. Just let it. So that's how I'd say.
Okay, thanks, Eugene. Semakula.
Hello? Oh, yeah, you can hear me. In my younger age, I used to be as romantic as Dorcas is these days, but I think I grew out of that a little bit. I would say which more like I don't. Yes, I guess it would be called I live. What's the word for it? Easily. I now live easily. I've looked at relationships of all sorts, with the exception of probably family, because I'm sort of sentimental like that. But relationships of most sorts, I look at them as they come, you enjoy them while they last, and when they end, you go. There are red flags, of course, which usually for me is say the no entry. Any level of violence. I happen not to be a violent man at the moment, much as I'm a meat eater. Any level of violence, no, is a no-no. I am not so fixated on cheating. I don't know. I've never been able to understand what cheating really is. That's a topic for another day. So I'm not really fixated on cheating. I'm more fixated on dishonesty. That to me again is a no-no. But generally relationships, they continue. If we both are into it, we stay into it. And the moment any one of us wants to get out of it, I don't hold on to it at all.
Thanks. I know we're out of time, but one last question. What about your partner has the money that they help you financially? Like maybe let's say the man beats her, but he has all the money and she has nowhere to go. What would be your advice to her? Just a question. The guy has the money and he beats her.
If she really has nowhere to go and it is his fault she has nowhere to go, I would suggest she gets the money and runs. There are always ways to pick out. If someone's giving you money, there are always ways to pick out the money. But in most situations, you are in that situation because you chose not to be an individual. I think this is especially with women. We have a habit of getting into a relationship and losing yourself in the relationship. So you become the relationship and you have almost nothing else outside of that relationship. In my opinion, I think people should always maintain themselves, a separate part of themselves outside the relationship, which they can rely on in case things go wrong, like in that situation where he's providing but he's violent or something. You should be able to get out. But in order to do that, it means that you've not only got to have your relationship, you also got to have a life outside the relationship. And that is where most of us fail. We get into a relationship and the whole world is lost out of there, is locked out. And when things go haywire, you have nothing and nowhere to go because you closed all you burnt all the bridges. That you should never do.
Thanks, Makula. Dorcas, the person has all the money and they treat you badly. What do you do?
Okay. Before I even answer that question, I wanted to add. I wanted to add maybe one more point on letting go in relationships, and this is applicable to friendships or other types of relationships apart from the romantic relationship, but it's also true for romantic relationships. I think reliability is a key factor in maintaining a relationship. We need to be able to count on the other person to come through for us in as much as we also come through for them. In essence, this is the principle of reciprocity. It's a reciprocal arrangement. It can't be that your friend always wants you to take her where she needs to go. If she's sick, she wants you to come visit. If a child is graduating nursery, she wants you to be there. But she's never doing the same for you. She always makes excuses when you need her to come through for you. So this person is not reliable and they're not being reciprocal in nature, in the relationship. It has to be a two-way street. Otherwise, it's not a relationship, that one. It's something else altogether. You have to put in the effort. Yeah, so that is one thing I wanted to add. On top of all the others I mentioned and whatever Lucheveleli spoke about, the psychological dimension is very crucial in a relationship. Yeah, so on the abused spouse that has nowhere to go, this is the number one reason why I preach financial independence. For women, because it's more common among women. Why? Because men tend to be stronger, or men tend to be socialized to be more violent than women. So we hear a lot of gender-based violence that targets women. And also because of the gender roles of the stay-at-home mom, that also puts them in a weak position financially. So we see that mostly affecting women, but it can also be true for men who depend on their partner financially. And anytime you are relinquishing this very important quality of taking care of yourself financially, of being independent, then you are putting yourself at risk of abuse. Sometimes it can be financial abuse where the person knows you need money for survival, you need money to buy this, to buy that, and they will deny you the money because they want to get at you. So that is financial abuse, or they can make it physical abuse. So that would be the case in the scenario you have painted of that woman who is abused by her husband. Nothing should make you compromise your safety, your well-being. Nothing. That's why it's very important to invest in your career or your business or whatever, such that you have something of your own. That way, nobody will take advantage of you. In fact, there are some partners who see a woman's vulnerability. Okay, here I'm just assuming that it's a woman, but it can be a man as well. There are big women out there. They're big physically and also pocket-wise, they are big. But for the most part, we see it the other way around. So you can find that a man will see a woman's vulnerability, the fact that she's a stay-at-home mom or a stay-at-home wife. He knows that she has nowhere to go. That is why he will take advantage of her. There may be others who might want to abuse their spouses, but then they remember that the spouse already has a thing of her own. She doesn't need him, she just wants him, and she can leave at any moment if she feels unsafe. So he will think twice before physically abusing her. But with this other situation, he's like, where will she go anyway? She needs me for survival. So please, let's be financially independent out there so that we are not put in such a position. Thank you.
Thanks, Dorcas. Eugene?
Yeah, now when it comes to such a scenario, number one, even if the husband, or we assume if okay, the partner, I don't want to assume that it's only men who do that. Okay, so if the partner who has a lot of money is, perpetrating the abuse,
if it's physical abuse and there's a sign of, impending, because anything can be abrupt in such a situation, even a death can occur. I think that will have to be taken seriously and even involve, even involve the cops and the appropriate offices, because that's close to, the threats. That's actually GBV going on, so that's unacceptable. Now, if it's not physical violence, if it's that financial abuse, because they have a lot of money, now they want to, they sort of mistreat their partner, and because they know they have nowhere to go. Um, how I would approach the case, number one, just as Dorcas had said, you sort of encourage the partner who is the one who is being abused, to sort of develop some sort of independence. If it's financial literacy, getting to know some sort of skills, I will literally advise him or her, um, the victims, to, to suddenly run away, because if the culprit notices that they're planning an escape, things might escalate. You might actually endanger the victims. What I will usually approach, perhaps, a sort of a strategic escape that takes time. If his or her life is not in danger, because yes, we have to rule out there's no physical abuse going on. But if it's that sort of toxic relationship, yes, you sort of plan a strategic escape. Number one, equip the victims with skills of independence, whether it's financial literacy, whether it's, starting something that they can be independent, just to break away the cycle of codependency from the abusive part. So once they are able to establish that, now to let go can be actually a smooth process. However, I wouldn't really say that telling them, run away and they don't have anywhere to go, it will just escalate the issue. And you will, even as a friend, you wouldn't really be for the opinion of, housing an extra person. Probably you would, but for how long? We can be realistic about it. Yeah, I will say that I will sort of help them plot a strategic escape ending to the goal of independence, and then probably try to avoid some in future, maybe to avoid such people, because the fact that you're putting yourself vulnerable to someone else to dominate over you, then abuse won't really be fun, because they know that you need them and it's not the other way around. There will be an imbalance of the dynamics. So that's how it's.
Okay, Eugene, maybe as a doctor, you can help me out here. I hear that some women have a pattern of getting abusive partners. I don't know, is that true? Some women, they keep on meeting partners who abuse them. It's like a pattern. I don't know if that's true.
What really happens, as someone who did psychiatry, what really happens, it's not about victim blaming, because it's like you just it's like you're just falling target, because we have to acknowledge the fact that yes, anyone can be an abuser, anyone can be abusive in a relationship, but there are some patterns in some people with some specific disorders, like the narcissistic personality disorders. They have a high likelihood of being abusers, because most of them, not all, most of them value control. So when it comes to issue of control, these are people you're expecting, if it's a relationship, they're the ones who, who make a lot of money. Number one, they are the people who have a huge say at home. They are the ones who make the final say. So if it's a narcissistic person, I'm not saying that it's only narcissists who do that, or I'm not saying that it's a criteria for diagnosing narcissistics, but narcissists usually love that. Most usually love that. So they sort of prey on the vulnerable. They prey on people who are not independent. They prey on people who prefer, for instance, there's this, even we can talk of the African culture, where it teaches the ladies or the women to be submissive. They can never have the final say. So it sort of predisposes them already to such sort of individuals. So when they come across a narcissist, or a narcissist will just have their own preferential praise. So it's such women. So you not necessarily blame the women for falling victim, or for falling prey or target to narcissists. It will be absurd. It wouldn't make sense to blame them. But what you can do is to equip them with skills to make them not be a target for such individuals. Like if you know that such individuals target people who are not independent, you can make them independent. You can equip them with skills. You can empower them. You can, even like things going for counseling therapy, it helps. Like they can be equipped with, let's say, skills to be able to tell red flags in whatever relationship they're going through, the power dynamics shift, the abusive partners, potential abusive partners, and even patterns that will lead to say that, you know what, this is financial abuse. They just have to be made aware, in short. So if they're made aware, it sort of makes them not to be a moving target for such sort of individuals targeting prey on them. So yeah, but it's true. Some might have a pattern. You might find a lady telling you that, you know what, I have a bad record because I keep on, it's like I'm keeping on attracting abusers, or I'm attracting manipulators. It's not that they're attracting them. It's that they're just, narcissists will have a preference. And most of them usually analyze people and they know what you need, what you don't need. So if they know that you're not independent, number one, they like you for that because they know they love control. So if it's money, that's what they'll be using to control you. If it's financial abuse, it will be that. So yeah, I think that's what.
Okay, thanks. Juliana, 3 minutes. If you have an abusive partner who supports you financially, what do you do? Juliana, 3 minutes, please.
Back to what Doctor said, I think Doctor also said, better to be safe than sorry. I wouldn't go there. I would rather I don't know, I would rather starve than be with an abusive partner. Number one. Number two, I would do my best not to put myself in that position. And number three, as people date and meet, the signs are always there, but sometimes we tend to ignore them. So I pay high attention to the signs. And actually, here's a good sign, actually. And I think I may be just assuming, but when I have dated, and if I go out on a date with someone, we go to a restaurant, and the waiter or waitress, doesn't matter, boy or girl, they come. I watch the way that person treats the waiter or the waitress, because to them already the way they treat that person is an indication of how they could treat me, because they're treating those two people, waiter or waitress, in not a very good manner because they don't respect them. So they're not respecting them because they're looking down on them. So how soon will that disrespect turn to me? Because right now, that's a lower person. How soon will that turn to me because I'll be a lower person? So that is always a red flag for me. And actually, I've always used it. I recall once this guy, he wanted to go out with me, and we introduced through a friend, and I refused. And the reason I refused was that as he was introduced to me, I knew he had another girlfriend, although that other girlfriend was, she happened to be Chinese, actually. I think they went to university together. So when they visited this Chinese lady, she was in a different room playing with my friend's kids. This guy is approaching me and trying to ask me for a date. I totally refused. So I said, if he can do that to me, and when his girlfriend is in the next room, how soon would he do that to me when he meets a different lady of his tribe? He happened to be lower than this guy. So these signs are always there. We just have to watch for them and stop being dazzled by all the brightness of this person you meet, whether they have money or not. So number one, I'll make sure I don't put myself in that position. And number two, if I so happen to be in that position, safety first. Thanks.
Thanks, Juliana. Doctors, you can close.
All right. All right. Thank you, Mr. Moderator, for that very engaging session. I always like how you compel us. You compel us to participate. Some people, they might try to free ride, but that's not the case for Morioki. He will call you out. So today we had some new faces. I'm very glad Kelvin joined us for the first time in 1.5 years. Thank you,
Julius. Julius was here for a while. I thought he had raised his hand a bit, but he left. Thank you, Black Messiah. Who else did we have that left? Ali El Maestro. He contributed a bit. And the people that soldiered on are
Rachel came. I thought Rachel was there. Did you mention Rachel?
Morioki, you repeat yourself. Like you need to just say one sentence and that's it. Umesema Rachel like 4 times. Okay, yes, there was also Rachel who joined us, but she didn't say anything. We also, I think, yeah, those are the ones that left that were dormant. But I'm glad that we had Zemakula with us. Hey, it's been a minute. It's been a long minute before we had you in our midst. So thank you for that. Thank you, Juliana, for your take. Thank you so much, Eugene, for your perspective, especially in the first portion of the discussion when we were talking about what medicine and about terminal illness. So you clarified 1 or 2 things which we were unsure of. And of course, there was Stano who also contributed a bit. He asked us a question. Last but not least is our moderator. Thank you for suggesting the topic and also taking us through it. It was very interesting, and I hope that we will continue engaging this way, guys. It's 1:21 a.m. in Nairobi, or in Kenya, actually East Africa, 1:22 a.m. So thank you so much for staying with us all this time. We will meet again next week, and we'll have an announcement for you then. So thank you so much. Guys, have a lovely